Crohn's disease. What is Crohn's disease? Crohn's disease is a chronic inflammatory disease of the gastrointestinal tract. Crohn's disease usually affects the end of the small intestine and also affects the beginning of the colon, causing ulcers and fistulae, but can affect any part of the gastrointestinal tract from the mouth to the anus. Crohn's disease can also affect the entire thickness of the bowel wall. Did you know that Crohn's disease was named after Dr. Burrell B. Crohn? He first described this disease in 1932 with a few other colleagues named Dr. Gordon D. Oppenheimer and Dr. Leon Ginsberg. Organs of the gastrointestinal tract include the mouth, the esophagus, the stomach, the small intestine, the large intestine, the rectum, and the anus. This is a picture of a normal colon. This next picture shows a colon with Crohn's disease. Causes of Crohn's disease. The cause of Crohn's disease is unknown. However, it is likely due to an abnormal response of the immune system. Food or bacteria in the intestines or even the lining of the bowel may cause the uncontrolled inflammation associated with Crohn's disease. What population gets Crohn's disease? Crohn's disease is often inherited. About 20% of people with Crohn's disease may have a close relative with either Crohn's or ulcerative colitis. In addition, Jewish people of European descent are at greatest risk for the disease. While Crohn's disease can affect people of all ages, it is primarily an illness of the young. Most people are diagnosed before age 30, but the disease can occur in people in their 60s, 70s, or even later in life. Symptoms of Crohn's disease include diarrhea, fever, weight loss that is unexpected, bloating, abdominal pain and cramping, anal pain and discharge, or a rectal abscess. How the diagnosis is made. The doctor will review your medical history. A specialist called a gastroenterologist may perform a colonoscopy or sigmoidoscopy to obtain bowel tissue for analysis. Other tests your healthcare provider may order include blood tests, including blood counts. White blood cell counts can signify inflammation. Low red cell counts is a sign of anemia from blood loss. Stool samples to rule out infections as the cause of diarrhea. Special x-rays such as a CAT scan or MRI of both the upper and lower gastrointestinal tract may be ordered, as well as to confirm the location of the inflammation. Complications of Crohn's disease may or may not be related to the inflammation within the intestine. Intestinal complications of Crohn's disease include obstruction and perforation of the small intestine or colon, abscesses, fistulae, and intestinal bleeding. Medication and treatment include immunosuppressants, antibiotics, antidiarrheal drugs, anti-inflammatory drugs, surgery, diet, and nutrition. Living with Crohn's disease. Crohn's disease usually has a chronic slow course regardless of the site of involvement. Medical therapy becomes less effective with time. Nearly 2/3 of people with Crohn's disease require surgery for complications at some point in their disease. The longer a person has Crohn's disease, the more likely they are to develop complications that can be fatal. Cancer of the digestive tract is the leading cause of death for people with Crohn's disease. Crohn's disease frequently recurs after you've already had surgery. Crohn's disease is not curable. It is very important to be compliant with physician's orders. While research is currently being done by the Crohn's and Colitis Foundations of America to find a cure.